welcome to the Legislative Report. I'm State Representative Rosemary Brown. You may or may not be aware that Pennsylvania ranks #1 in the nation for Lyme disease reported cases, which is why it has become very much an initiative of mine to do what we can at the state level and also work with our local officials and local organizations to do the best we can to help our residents of Pennsylvania be able to prevent Lyme disease or tick-borne illness, or as well as treat, get accurate results in testing, and also have some ability to have the ticks tested to ensure that we know what we're dealing with in Pennsylvania as we move forward. So I am honored today to be with several people who have worked extremely hard on their own and with me as well to combat the Lyme disease and tick-borne illness epidemic that we're having in Pennsylvania and trying to make a difference. So thank you all for being here. We are going to have probably a very comprehensive, all-around discussion to help our local viewers understand what we're dealing with overall in Pennsylvania, but especially in the northeast region of Pennsylvania and Pike County, especially too, which very close to Monroe County, so the two counties. But the work that you're doing in Pike County is amazing. So let's just let you introduce yourself. I'm sure many people watching already know you, but let's do the introductions and we'll go from there. So
thank you, Rosemary. I'm Matt Osterberg, Chairman of the Pike County Commissioners.
Nicole Chinisi, the Laboratory Director at East Stroudsburg University's Tick Research Lab.
And Rosemary Shep, the Chairman of the Pike County Tick-Borne Disease Task Force.
Wonderful. So we got two Rosemarys on. That doesn't usually happen, right? We don't hear her name that much. But I know you all have worked very, very hard on this, and we have a teamwork effort as we're trying to identify how to do things better and how to really help people, like I said, on prevention and diagnostics and treatment. So let's go back to, first of all, the issue that we have in Pike County. And I don't know, because as you know, establishing the task force, and I know, Commissioner Osterberg, you really were right on this right away, as saying, hey, listen, we have to do something for our county. And what is that going to be? And what are going to be the realistic, smart things to do? So take us to how this started and where your efforts began. And I think probably with Mickey, right, was part of it.
It started off in 13-14 when a woman by the name of Mickey Weiss came to me who was suffering from tick-borne diseases. Lyme disease was her, and then some other pathogens were affecting her lifestyle. And I didn't realize how much of an effect it was having on many residents in the county until I sat and spoke to her for an hour. And then I realized, I went to the other two commissioners at the time and said, this is something we need to address. We decided that it was important that we bring community members and stakeholders into the room and discuss how we move forward. And the Tick Task Force, and now the Tick-Borne Disease Task Force, was developed out of those conversations with the concerned residents, both Mickey Weiss being an educator, people that were involved in the medical fields, people that were scientists, and then also just educators also telling us that, this is affecting people in our schools, this is affecting lots of people in the population. So we needed to address it. The state in the beginning, right around then, was doing their the white paper. So the state was even starting to realize that this was an epidemic. We realized in Pike County it was truly an epidemic, considering that there was, by 2016, there was 115 people that we knew of that were suffering from tick-borne diseases, and many more coming forward.
Right. So at that point, it was starting to say, okay, people are sick, and when a constituent comes to you, and you realize, oh, this is one, but then as the conversations expand, you start to realize you have a problem locally as well as what you've heard from the state level. And I remember Mickey telling her story, which is crazy because hers was almost the misdiagnosis and where it kind of moved forward and became more debilitating over time because of the lack of treatment or the lack of diagnosis, as far as what I remember the conversation. And that was her really big push to say this can't happen to someone else.
Correct, and that's what we didn't understand that either. We didn't know that the medical community wasn't recognizing this as a crisis, and we'll call it a crisis. Back then it was, and it still is. We didn't know that. In the commissioner's office, we're dealing with lots of things, and this isn't one of them that's truly always on our radar. And then even from that, people said, why is the county commissioners getting involved in this? Well, county commissioner's job is to manage emergencies. I always look at things, I'd rather manage something before it turns into a full-blown emergency,
Right.
And that's what we did. And we reached out to people like you, and reached out to Lisa Baker, and eventually to East Stroudsburg State University, Michael Pfeiffer's office, and explained to them what was going on. Although in the case of East Stroudsburg, they knew there was an issue. They were the educators that helped us educate our population. And then we realized that as a task force, our role really was, let's educate the public, let's educate the residents, so that they can be fully aware of what's out there. As I've stated many times, we weren't out there to put fear in anybody. We wanted to educate them, want them to be prepared for this. Pike County is a tourist destination. We don't want people to think that this is some, issue that they shouldn't be going out and enjoying the outdoors.
Right.
At the same time, we wanted to make sure that there was a balance, right? And that was it was at times it was a tedious balance to make sure that happened, because some people really wanted to go out and tell the story, but in a way that maybe started to alarm people. And we in the commission have said, no, let's educate it. Let's go to the schools. Let's get the right people in there. Let's get the doctors in here and the biologists from East Stroudsburg, and let them explain to us what it is that we have to do in prevention and suppression and in just surveillance of the community, and educate them.
Right. So at that point, you realize the issue, and Rosemary and Nicole, you can talk a little bit more about, because I have a packet in front of me about all the information that's in here and what's available to the Pike County residents to be able to utilize. So when you started to work with Nicole, and obviously Nicole and I, for the viewers watching, have worked very strongly with a free tick testing for Pennsylvania residents. That was initially, I had gotten through a grant through Department of Human Services, and then this year's budget, I was able to help advocate and get that into the Department of Health budget. So it's a $500,000 grant that supports subsidized free tick testing. So if you do find a tick on you, to please take that tick, put it in a plastic bag, and then send it over to East Stroudsburg University through the mail, and the testing is free. So ticklab.org is what we want to keep saying throughout the show, ticklab.org. Do not throw out the tick. It is a tool for you to be able to see how long that tick has been on you, if it is infected with any diseases, and it can be a better guide for you and your physician. So I think that's a really key piece. But it's growing on the tick testing, but you were also doing this with Pike County on some of their studies. So talk a little bit about that and the study and working with Pike County.
Sure. So Pike County Tick-Borne Disease Task Force is a great task force. They're really on the front lines of getting information out to the public, which is important. But in addition to that, they understand that the science and research to support what they're doing is also needed. So they went behind scenes, they applied for grants, they were successful in getting those grants. And what those grants allowed them to do is, in collaboration with the university, we've gone out and collected, our target goal is 1,000 ticks from the environment. To really understand what diseases are in the environment of Pike County. And all of this education goes back to the residents and back to the physicians, so that they know when they're going to diagnose a tick-borne disease, if there's a prevalence rate of over 20%, these physicians should be thinking of what the prophylactic treatment is, or what should I be doing to treat these patients. And it's not just Lyme disease that we're finding in these ticks, and that's also a really big thing, and that's why it's called the Tick-Borne Disease Task Force, because it's not just Lyme disease. These ticks are carrying multiple different diseases. These diseases interact differently. The patient will present differently. So the patient itself, they're giving education to the patients, but also to the medical community, and they're giving a lot of information out there that's very useful. And so our study, almost complete, we should be done this fall, will be published, and it's 1,000 ticks from 9 grid locations across the county that we've divided, giving us a lot of statistical power on what we're finding.
Yeah, and so you have 67 counties in Pennsylvania. So the state level work is taking those ticks that people have removed from them and sending them to the lab. So you're getting that information over. But Pike County has taken even a much more proactive approach and getting anybody that sends in from Pike County, but then they're getting the additional documentation of what's inside the ticks, which, like you said, helps people in Pike County and the physicians to know that, well, we're seeing a lot of this in Pike County, and you should be aware that to treat, or whatever the case may be. So it helps the people in Pike County tremendously to know what is inside these ticks versus what will be out inside the ticks in the western part of the state.
Exactly. And it's getting down even to more of a grid location. So the study with the state, we will eventually get down to this, but this study is location, communities. We have GPS coordinates of where these tick populations are occurring. So it makes it more specific when you do it that way. So that also is giving them a lot of information that they can give to their physicians and their residents.
Yeah, because at the end of the day, what all of us are trying to do is to make sure the patient gets treatment as quick as possible. So if you don't know what you're treating, this information gives a little bit more, again, of a guide to help that treatment process. So the research is actually turning into something effective to help the treatment process. So get treated quicker, earlier diagnosis, and have a better idea or a higher percentage idea of knowing what you're dealing with. So the ticks are oftentimes, there could be a co-infection inside a tick. And Rosemary, we're going to get to you because we're going to let you go through all of this that Pike County is doing with the information to help people. But Nicole, in the ticks having co-infections in them, and just talk a little bit about that for viewers who may not be that familiar, that it's just not oftentimes one bacteria inside the tick. It could be, we could all have different types of infections.
So the study that we're looking at, we have 7 different diseases that we're testing for. So Lyme disease is just one of the cases of the diseases we're testing for. And when you have a tick that's carrying more than one disease, it can really complicate the entire system. So from diagnosis to your symptoms to everything. So we found, and I believe it was 11% of the ticks in Pike County that were co-infected. Our state study shows 12%, so very comparable. So these ticks are carrying more than one disease. And when it comes down to these diseases, ticks can carry bacterial diseases, viral diseases, and protozoal infections. So when you're treating a disease, you can't treat antibiotics across the board. Antibiotics are just for bacteria. It's all that they're used for. So when it comes to viruses, you have to treat, usually there's no treatment for viruses. It's usually hospitalization, fluids, things along those lines. And protozoal infections are similar to malaria infections where they have to be treated differently. So their treatment's different than bacterial and viral. So if you have a tick that bites you that's carrying bacteria and a virus or bacteria and a protozoum, it could really complicate your treatment process. And these patients are being treated with antibiotics but never getting better. And their physicians may not be testing them for other tick-borne diseases and thinking, oh, well, you have Lyme, but it doesn't mean that's all that they have. And it doesn't mean that's all you're exposed to. So you really should understand the entire tick-borne disease panel and what your exposure could be.
Right, and that's something that hopefully everybody watching will gain a little bit more knowledge so that they can take it to their physicians. I know I'm working very hard to try to get continuing medical education for the physicians, at least a couple hours a year until we get a little bit more knowledge and understanding of these tick-borne illnesses, so that we can put some more focus on that so we don't miss patients. It's very hard to be a physician when you have this sort of disease state, and there are many diseases we don't know a lot about. But right now, because of the epidemic that we're in Pennsylvania, that it is important for them to have some focus and to really get them the newest data that you have and to understand, what infections that we're looking at. So this is crucial information that the lab is doing, and we're always grateful for that, and we're very happy at the state level to be partners. And I'm thrilled Pike County really went up and beyond and did some very strong work to get those grants to work with you and get that information to even get more for Pike County residents. Rosemary, the information that we had a hearing earlier this morning that was very effective, that Commissioner Osterberg presented some of the information and all the hard work. Now, I know this has been years because I've watched the pieces and all the work come through. The one thing that I saw in here that was interesting this morning, and we all talked about it, the legislators, was the tick removal. And people might not know, but if you pull the tick out incorrectly, you could traumatize a tick, and it's not really pleasant to talk about, but it could sort of regurgitate the infections quicker into the bloodstream. So it's very important to remove the tick the right way, right? But this is one of the things that you have available. So let's start with this, and we'll go through some of the things that you offer for the Pike County residents.
So the tick keys, are very easy to use. And it's one of the best ways to remove a tick. You don't. There are lots of guided ways to remove ticks on the internet. But this happens to be one of the easier ways to do it, just putting the ticky over the tick and then just making sure that you get as close to the skin as possible to remove the whole tick. So that this is actually a great tool that we have for the residents. And I know that they are in the Pike County.
We have those in the treasurer's office. We have them in some sports shops. And they were donated. I think it's important because this is what we've talked about in Pike County. We have partnerships with many people. These were donated by the Hemlock Farms Conservatory because they understand the issue that's going on also. So they made these available to us and donated a couple of hundred of them now. And what we do is we sell them in different locations, and that money then is used to help develop all of these educational materials, paying for the printing costs or whatever. But more importantly, it's just the partnerships that we've developed through the task force. They came forward after they heard of what we were doing and what people like Rosemary and Nicole were doing and said, we want to be a part of this. We think this is an important issue. They have people in their community that are suffering from tick-borne diseases also. So that's how that came forward.
And that's actually how I came to the task force myself. As a victim of Lyme disease, I met Mickey through a support group, and she encouraged me to come and help out. And I actually offered help because I didn't want anybody else to be suffering the way that I had. And what I realized is how little I knew about Lyme disease and about tick-borne diseases in general. And so I found that my role on the task force is trying to get information out to people in common language, and especially to the children of the area. Children's that's where my background and what kids are where it's at. And I truly believe that we need to get the information out to the kids. And so one of the things that we've created in the task force is a small little pamphlet for the kids about what they need to be aware of, and what they should do if they see a tick. Not be afraid, but tell a parent or an adult. And so that was one of the things that we give out at information booths. Any events that we're holding, we give out some of these things. One of the other, I know that ESU came together and made the coloring book, and this is another way to get information out to the kids. And like I said, I think that getting the information to the children is important because not all the adults know what it is that they should be looking for. They think, sure, I know everything. I've heard of Lyme disease. It's not a big deal. But it is a big deal. And so it was important to get simple information out to the community.
Right, like even the very, very simple remove the tick and throw it out. That in itself is really no longer, if you're lucky enough to find the tick, because sometimes we talk about this, Nicole, as the nymph, the poppy seed size tick can sometimes just fall off and you would never know you had a tick on you. So when a doctor says, well, if you're not feeling well, did you ever have a tick bite? No. Or maybe you'd say, I don't know, but you wouldn't know that you even had a tick on you. So if you're lucky enough to find the tick, then and have the ability to test it, absolutely do not throw it out. So these are more educational pieces where back in the day it might have been that mode of take it off and throw it out or burn it, whatever the case may be, whatever the family mode was. But I think that piece in itself and knowing that you can then send it for free tick testing is so important for people and for the kids. The other piece that from your information and then also the information with Nicole and ESU is around your house. And when the ticks that were sent in so far have been tested at the lab and the results have come back, and Nicole, you can talk to this, that you have found out where most of the people were exposed. And it's very interesting because this mindset of being out in the heavy woods or whatever it is, that's where everybody's getting exposed, but not so according to some of the stats, right?
Yeah, so in our study, we are asking residents to take a survey, and this survey is mandatory for them to get the free tick testing so that we can collect the data. And what we're asking them is a lot of different information of where they're getting their ticks. So the location, the best that they know of where that tick could have been picked up, whether it was their backyard, park, whatever it would be. They're describing this location, residential, state park, and we're asking where it's biting them, the age of the person, if it's human or animal, because we test all different ticks. And when we evaluated the information, we found that over 50% of the ticks that came in, so we tested 6,700 ticks from the state, over 50% of these were on residential properties, and the activity that they were conducting during the exposure was playing in the backyard for children and gardening or mowing the lawn or yard work for the adults. So over half of the time, you're being exposed to a tick bite in your own backyard. It's not, there are some cases in the state parks when you're hiking and things like that, but you need to be aware in your own backyard when you're doing your yard work that you have to protect yourself. Anytime you go outside, you should be protecting yourself and your pets.
You almost feel like it's a safe zone. Like, I'm in my house. I'm okay. I'm right outside my house. I'm not far deep into the woods, but it's almost that safety feeling. And that goes hand in hand with taking it right to your backyard with the Pike County, the task force, is you're saying, hey, listen, pay attention. This is right in your backyard. We're trying to take care of you in your backyard and offer you the best resources, support groups, and the wellness center now that's up there as well. So what else with, you have the Tick 101. Either one of you can talk about the Tick 101 information.
So our next steps,
Yeah.
just as we're speaking about, is suppression. It's talking about homeowners and how they can protect themselves in their yard. We're working on that piece of literature right now. Our plan is that we're going to put that piece of literature out when ESU is complete with their study, so we can show people, here's the areas where ticks are being shown and what they're carrying. But at the same time, we're going to give them ways to protect their yards, what they need to do to, there was some speak today about Japanese barberry, making sure that's removed out of their property, maybe using environmentally friendly types of insecticides, just so that people are aware of what they can do around their yard, mowing their lawns. I mean, I've already read that some of this has to do with even where you store your firewood. Things like that should be kept away from the house. So we're trying our best to just make sure that people understand what it is that they need to do on their own to protect themselves, along with all these other pieces that we have, the Tick 101, there's the piece of information that ESU put out about the tick collection, where you can send it in. All of these are going to be put together in a packet so that we can hand them out at every county fair that we go to, any type of senior expo that you just held.
Right.
We were there. Just getting this information out and getting into the hands of the public so that they can see and they can educate themselves, because all of this stuff comes down to education. Well, we need to focus on educating the doctors. In some respects, that's way beyond my abilities to do that. But I can educate the public, who then can turn around and educate their doctor.
That's right.
Right? They can go to their doctor and say, I found this tick on me. I had it tested at the ESU. This is what the tick had. Not to say that I have that, but you know what? I have some symptoms, so maybe we should start to do these tests, That's what we're trying to do, and that's what we've been trying to do. And I think we're successful in the last 6 years. We've come a long way. 5 years, it seems like 6, but maybe it's only 5. But that's what we're trying to do. We're just trying to continue to go out there and educate people and continue. So the next step is going to be suppression. That's our next.
Yeah, so true, because each person that gets educated educates the next person and pushes the physician or the healthcare provider as best they can to say, I'm not feeling well, I'm feeling well, and everybody has so much to learn. So the more everybody gets educated, the better it spreads. So
And you're right, with the wellness center in Wayne County, at the Wayne Hospital, that's really important, because this information, because before this, I don't think people were being felt like they were being listened by their medical providers. Now there's a place in Pike County where people can come from all over to go there, and they can go there with their information. And the people there are what I guess we can call Lyme literate. We met one of them today in Harriet. She understands all of the issues that are going on with this. And now this information is going to go to somebody who's going to say, well, thanks for bringing this to me, because I know what to do with it.
Mm-hmm. Yeah, a little more in tune to sort of the symptoms and the diagnostics and things like that. And one of the interesting things I found about the Wellness Center, too, was that you don't have to obviously have the Lyme disease or tick-borne illness diagnosis, or even had anybody ever tested you before. You would think sometimes people would have tested and have negative or whatever, and then go to that wellness center. No, you can have that happen where you still maybe are questioning your results, or you could go straight there with, I haven't been tested for anything, I'm really not quite sure, but I'm a little concerned. So it's really a very open type of patient to go there, maybe a patient that feels like they are suffering for something that just doesn't seem right. And it's interesting, and even on the insurance coverage and everything seems fairly productive there in some ways. It could get better, but I think that it is productive in some manners there. So if patients have anybody watching has a concern about that, they could always call the Wellness Center as well. But the education piece, I think you and I and the county and even from the state level are very much on that mode of trying to get that communication out, even after today's hearing, with if your kids are outside playing and the 2 to 10 age group is the highest age group and they're out there playing, how do you treat that yard so that it's safe? You don't feel like there's chemicals there, but you go around the perimeter or you do some other things, like you said, with the landscaping. So there's a lot of things that people can do to reduce the risks and help them and just move forward. And then if for some reason you suspect something, we have some of these other tools, and hopefully the medical community is getting a little bit more in tune with everything as we move forward as well. So is there anything else? Time goes very fast when we're on these shows. So is there anything else that any of you would like to think that we might have missed that maybe some of the local viewers would want to know?
I think it may be important to talk about the support groups that are out there, because there are people that are probably watching this that wonder, they're suffering from this and maybe they need some support. So there's a support group, I believe, in the packet here.
Yeah.
One held at the Pike County Public Library. I believe Wayne Hospital also holds one also.
Right.
Because people are looking for places where they can go at least talk to people about this that are suffering, because it is life-changing when you talk to people that are truly in the throes of some form of tick-borne disease, and that's what the support groups are all about. And that's also developed out of all of this discussion that we've had in the last couple of years. So that needs to be shared with people, if it
Yeah.
can be posted here somehow as
We will
on the air,
definitely put that out. We will post that here at the end, and if anyone has any questions.
And I guess
after, they
also
can
that
call.
the task force meets, is it the first Wednesday?
It's the fourth
Wednesday.
Thursday.
Fourth Thursday. Look at that. I got too many meetings. The fourth Thursday at 10 o'clock at the Pike
Right.
County Commissioner's office, and we welcome everyone to come.
So that's a great thing too, right? You can put your input in based on it and use additional help.
If you want to serve, we'll put you on. It's not like we have a board that is limited to, 10 people, 12 people, whatever. If you have something to offer or you just want to come and listen,
I
please
think that's
come.
what the great success of this group is that it's so diverse and everyone comes at it from a different angle. We all have something that we want to contribute and share and help, and that's why it's working. We have educational materials. We've worked with the school district. We've worked with ESU. There's just a lot of different angles that come into it, and the more the merrier.
Great.
Delaware Valley and Wallen-Pawpack school districts have been there.
Yes.
As we reported today, we helped them develop a protocol of how they deal with that in the nurse's office. Prior to that, the nurse was getting the tick,
Right.
pulling off and
Exactly.
throwing it out. No one, not a parent knew, no one knew. Now they understand the importance of it. So, that came out from this. I know that's something that the state really wants to get in place in the Department of Education, but, we were able to do it at a grassroots level
Right.
and get the school districts locally to listen to what we were saying, because we had the right players at the table. It wasn't like it was just a county commissioner telling
Make it
them.
effective.
It was the educators, it was scientists saying, hey, this is the way you should be dealing with this.
No, and that's effective and productive, getting things done. So thank you all so very much for your information. I hope that the viewers did get some more education here and know where to get more education. I'm State Representative Rosemary Brown. Thank you very much for watching the Legislative Report. If you have any questions regarding this matter or any other state issue, please feel free to contact my office.